As a massage therapist taking care of clients, I have to be cautious about hand, forearm pain because of lots of work with my hands. I've been doing what I do for 10 years and don't have any ongoing huge issues with hand or pain. I have had wrist pain at various times. Sometimes I feel a little achy, but I work with it. Use yoga, trigger points, various kinds of body work to work with it. And it's actually greatly improved from years ago where I was having trigger points and other problems. I wanted to talk about the hand today. We talked about, in previous videos, subclavius, pec minor. If I remember correctly, it was flexor carpi radialis, flexor carpi ulnaris. And now we're down into the hand itself. I want to talk about opponens pollicis, which is one of the guys that pulls the thumb over this way. It generally connects over here and goes out towards this thumb. And when you're pressing into it, if you think of this joint to this joint, you're just about in the center. You're right in the belly of this muscle right here. When you're having problems with this part of the hand, you'll sometimes get pain in the wrist here, and you'll sometimes get pain down to the thumb. What I'm going to do is use my opposite thumb to apply a little bit of pressure. And you're basically right on top of the bone, right here. You're not higher up into this, you're actually on top of the bone. I'm going to place my hand on my thigh so there's a little bit of additional backing, a little bit of a foundation there. So I'm going to lean with my opposite thumb into that muscle, and I'm then going to slowly begin moving my thumb around to access the trigger point in that part of the muscle. I can start to feel it down my thumb, maybe slightly into the center of my wrist. I think I also feel it down into my pointer finger on my left hand. But it's helping open up this muscle here that we spend so much time tightening, constricting as we work as massage therapists. I'm also going to work on the opposite side. You always want to do both. And this one actually feels a little bit tighter to me for whatever reason today. Feel that more down to my thumb. I'm going to gently begin moving the muscle underneath my finger just to get it to engage. You can breathe. Just trying to get that sensation to release, trying to get the muscle to lengthen, to let go, till the trigger point stops sending referred pain. If you don't like using your hands, you could possibly use something like a marble, something small, that you can put down, that you can lean directly under that portion of the muscle. You can then move your thumb around. If you had someone else work on you, they could use their thumbs, possibly even an elbow, but you'd have to be careful and also use the point. You may possibly be able to have the person's hand down and use the elbow right into that spot. Again, it's opponens pollicis, I believe I pronounced it correctly, right here on the thumb. I'll see you again soon on robertgardnerwellness.com.